My name is Katelyn Terry, and I'm a nurse in the Pediatric ICU.
I'm Amanda Payne Lindsey. I'm a chaplain for Cook Children's Medical Center. Today we're here to talk about peer support in our clinical settings. These programs have been around since the early 2000s in lots of hospitals, and what they do is they train peers to be able to look out for the people they work with and see if they're in crisis, if there's anything they can do to assist them and to be present and listening ear. It really is a program that's supposed to help healthcare workers have an easy and low threshold to access mental health services. The reason this came about is actually because we've seen a huge increase in our mental health needs of our pediatric patients. And really over the last couple of years, especially post-pandemic, realizing that our healthcare workers are also facing the same mental health crisis that our patients are seeing. And so while we have this higher acuity coming in with our patients and seeing more suicide attempts and more behavioral health issues, really recognizing that healthcare workers also have the same increased needs. They're a vulnerable population. They're a population that's so good at helping others and really notoriously bad for seeking help for themselves. There's a lot of stigma around mental health, around clinicians and around healthcare workers. And so we're trying to make it easier for people to reach out and get help, and also to create a supportive environment for our staff members who are experiencing traumatic things at work and have to then return to that unit. Our frontline workers and people working in healthcare deal with a lot of challenges. They have demanding work. People in the ICU deal with a lot of pediatric death and dying. It's very difficult, hard work. And so it's really important that we provide an extra layer of support for the staff so that they can continue to do that really hard work and provide excellent care. It's also important that we take care of our staff so that their psychological safety is intact. So we help reduce patient harm and allow them to safely return to bedside. All of those things are very important for our clinical workers. And again, our healthcare workers are very good at taking care of others and sometimes neglect their own needs. And so this program is really important to try to reverse that and offer them opportunities for help.
Working in the pediatric ICU can be really challenging. It's a really high stress environment, and each day that I show up to work, I know that I'm helping patients and families through what is arguably the worst day of their life, what is their own trauma that they are working through, but I am there and I show up to help them, and all of my peers do the same. But that means it's stressful on me. And on top of all the stress that comes with the interventions, the alarms, the equipment that we're using, so that stress in combination with their own trauma and can be traumatizing to us as healthcare workers. The peer-to-peer support program has been wonderful because it has given me the tools, the resources I need to provide support to my peers. So as Amanda said, we're terrible about asking for help for ourselves, but this allows me as a peer to check in, give resources when they're needed without the stigma of going to a licensed professional. That's why I think it's so important, and it's been really beneficial in our unit.
One of the things I'm most excited about with our peer-to-peer program that we are rolling out at Cook Children's is a component of suicide intervention that we have embedded in the training. It's called QPR. It's Question, Persuade, Refer. We've been working with Jordan Elizabeth Harris Foundation to have this utilized in our training. And one of the things that we don't talk about a lot is that our clinicians are actually at increased risk of suicide. So physicians in general are 4 times more likely to commit suicide than the general public. Anesthesiologists are 6 times more likely. There's also data emerging around nurses, but that hasn't been published yet. So really understanding that, again, these people are seeing a lot of trauma. They're dealing with difficult situations. Most pediatric ICU nurses have PTSD. A recent study said that 20% of ICU nurses have all criteria or meet all criteria for PTSD, while 80% show at least 3 markers for PTSD. So I think it's really important that we talk and have conversations around suicide and equip peers to be able to ask the hard questions of, are you thinking about committing suicide? And how do we have conversations lovingly to help that person get help?
Engaging in conversations like that are not easy. And so the peer-to-peer support program has been really beneficial in helping prepare me and equip me with the resources necessary to start those conversations. Because I think we're all guilty of asking how a friend or a peer is doing and just taking good for what it is and walking away. But this program has taught me the importance of checking on my peers, not only within the walls of Cook Children's, but outside as well, because their life is important and it's worthy, and they are so much more than an employee that shows up to Cook Children's and works and does their job and leave. And so the peer-to-peer support program allows me to have those meaningful conversations to really check in and know how people are doing.